My name is John Kazuaki Maesaka, and I'm a nephrologist in medicine. Well, I've always wanted to be a doctor of medicine since I was a child. I was mainly into sports. I was an all-state baseball player, all-city basketball, traveled around Japan to play baseball. But I grew up in rural Oahu in the middle of pineapple fields where my father was a dentist. After the war ended, my parents sent us to Punahou School, which is a very famous private school in Honolulu, and where they had a quota against Asians, a 10% quota against Asians, and we went there with that in mind, and we were taught to be very obedient and good citizens. Getting into Harvard was, oh my goodness, quite an experience where it was changing my whole outlook in terms of life. Eventually graduated and went to Boston University School of Medicine, and there I didn't know what I really wanted to do, but I knew internal medicine was where I was most suited for me. And I was very fortunate in getting an internship and residency at Barnes Hospital at Washington University in St. Louis, where I worked extremely hard because I felt the responsibility of being a physician, and people were putting their lives into my hands, and I felt that responsibility, and that's all I did was work. Never worked so hard. I was then drafted into the Army in the middle of my residency, and I spent 2 years at Fort Sill, Oklahoma. I had no idea how much I had progressed until I went to Fort Sill, and I realized I was much better trained than everyone there. It gave me this sense of confidence, and I felt that just being a great physician, which I did a lot of very interesting things there. So I went to New York at Mount Sinai Hospital to be with my medical school roommate before I went back home to Hawaii to practice medicine. The first place they put me into was in nephrology. And I had no idea that I would be going into nephrology, but I immediately got into the laboratory. I realized that I really mastered being a great clinician. And I had every confidence that I could compete, but I realized how much work it required. Every day I would spend maybe an hour or two just reading one article because it was so science-oriented, and I didn't have that background. But I thought, gee, this is really interesting, and maybe I should consider doing research. The primary goal that I've always worked with was everything had to come from my mind. Whether it's clinical medicine or research, it has to come from me. If I didn't think about it, I always said, my goodness, why didn't you think about it? To me, I've always credited Punahou High School as a turning point in my life, because there I learned to speak proper English and got accustomed to being in the Western world because I grew up using chopsticks and learned to use a fork and knife. Well, with all this background in the laboratory, I started seeing patients with hyponatremia or low sodium in their body. And the most common syndrome is the syndrome SIADH, as we call it. And SIADH patients have too much water in their body. And I came across a patient who I figured had too little salt and water in their body, but they looked exactly like patients with SIADH. The blood tests, the urine studies, the routine ones were identical. with one another, except that one patient had too much water and the other didn't. This started to take hold, but not many people really believed in what we were doing. And we continued working with this uric acid metabolism and started to change our approach, because the old approach is you look at patients and you say, well, they have too much water, they have normal water, or too little water in their body. But everybody knows, if you look at a patient, you can't tell whether they're high, normal, or low. So I began to question this and to start making changes because of the physiology that was required, and that's where the 5 years in the laboratory was the best investment I made in preparation for all of this. If I were to summarize my work, I would say it was incredibly unexpected. Because of where I came from, and I just did not have these expectations, and I just followed my passion. I would be leaving my legacy for my descendants, and I think it's important for them to know where they came from, because being Japanese and living in this country, they're all intermarrying, and over time it will be diluted out to being virtually non-existent. So in some way I'd like them to know where they came from, and that it came from immigrants from Japan, and my mother came from an extremely wealthy home of samurai class, and my father from farmers. But they should know that, and this is one reason why I'm doing this, in order to let them know where they came from. Well, I think I really want to be remembered for being a very good parent and supportive of the entire family, and being blessed with really 2 good boys and a wife that I hope will be examples of what it's like to have a family of this type, but also how creativity was a very important part of my own approach, and that this led to making a contribution in medicine that has far-reaching implications. Something that I had not said before is that this is really a great country. And I've grown up during World War II with a Japanese background and having problems that way. But there was no prejudice as far as I'm concerned. And this country provided me with the opportunity to grow and make contributions and fulfill a dream. And as they say, you are happiest when you are creative, when you solve problems, when you have creative thoughts. And I think I've been very fortunate to be able to do that in this country.